Ambia. I'm going to be going over how to do an MFT, and I'm going to explain the role of the medical assistant. So first things we want to do after we've already done the H&P and the vitals, we're going to go ahead and set up for the procedure. So you want to make sure that the area you're going to be working in is clean, and if not, just wipe it down with a cavi wipe. I've already done so. So you're going to grab some gloves, put on the gloves, and up here you can find the purple bib that we use. Just lay it out. So everything you should need should be in the drawers. So in this location we set out polydocanol that's already set up, and we know because we have the P's on there. And then we also lay out STS as well. So I like to lay out 4 of each one. The needles are already capped. You also need one stopcock. And you need one 3 cc syringe. Also you need the needles. So it depends on which provider you are working with. Different providers like different gauge needles. So we lay out 30 gauge needles. I lay out 4 to match the amount of syringes that I laid out. And then we're also going to put out 4 27 gauge needles. So to continue setting up for the provider, you're going to open up the 3 cc syringe, draw back to 2, remove the needle from the syringe, and dispose it in the sharps. You're going to open the stopcock, and you're going to take this handle and then twist it so that it's pointing vertically straight, and then remove these 2 knobs right here and attach the syringe with the 2 cc's of air to the bottom, and then I'll just lay it right here. That way the provider, when they're looking at the area, can decide whether they want to use poly or STS, and they can easily just attach it to the other end and mix it. The needles I leave closed because I don't know which one they want to use and I don't want to waste. So that's how you set up for MFT.
Hi, this is the provider portion of a MFT injection. As you can see on the setup, we have sodium tetradicyl sulfate, and we also have the choice of polydocanol. Both are FDA-approved sclerosing agents, so when injected into the vein, basically they harden the inside wall of the vein, and that vein will shut down and can eventually be absorbed within the body. You take the syringe that has already been set up by the MA that has the attached stopcock. You want to make sure this is pointing up. You pull it to the 2 cc mark, and you grab your choice of medication, which is marked with either a S or a P on the bottom. You screw on the medication and you mix, which is basically foaming the STS or sodium tetradicyl sulfate. You want to mix approximately 10 times. You pull it to the 2. So you know you have 2 cc's of foam medication. And then you take your selected needle, which is either the 30 gauge needle or what I use, the 27 gauge needle. Once the medication is mixed, the ultrasound tech has already marked the spot and is set up on the vein. So you take your needle,
here's the pinch,
inject the patient, and while watching the ultrasound on the TV, you inject right into the vein, you pull back, and you will see a flash, which the MA will tell you, and then you inject your medication. Okay, so when you look at the ultrasound screen, you can see the vein. When compressed by the ultrasound tech, it almost winks at you. This would be different than an artery. An artery will not compress as easily. It has a thicker wall, so that is a very easy way to tell the difference between an artery and a vein. You will now see the needle going into the vein. So we are now in the vein, we have a flash, and we are injecting. And you can see that white medication injecting in the vein. And now the ultrasound tech is going up, and you can see the travel of that medication. You can inject up to 6 cc's of the medication at any treatment during their treatment plan. Follow-ups do follow a little different rule, which we will not discuss for training purposes at this time, but during their treatment plan microfoam therapy treatments, it's 6 cc's at a time. And you can inject up to 10 cc's, but Allure has found best practice is 6 cc's.